Greetings. Today I want to talk to you about digital retinal imaging, DRI. Our office, Holistic Vision Care, has been the founder of using this principle to diagnose disease. I want you to know what it is and why it's relevant to people as young as 15 or less years of age. Digital imaging is the ability to use digital technology to capture a highly detailed picture of the retina. That's the very back of the eye, which is lined with blood vessels. Those blood vessels can reveal health issues such as diabetes, hardening the arteries, risk of stroke, heart attacks, and many other conditions. The blood vessels at the back of the eye are as thin as human hairs, but when captured in the DRI environment, the digital retinal imaging environment, the blood vessels are visualized the size of soda straws. We can see how the blood vessels are handling blood flow. Why is that important? If you've ever had a garden and you don't water your garden, what happens? Well, if you don't water it, the plants die. The same thing is true of your body. If your blood vessels are not circulating the blood well through your body, your whole body deteriorates and you age prematurely. Strokes, heart attacks, diabetes, all sorts of things become prevalent. Would this really affect someone 15 years of age? Well, I recently examined a young man who had significant hardening arteries, and he was 15 years of age. By the way, he was physically active, looked great on the outside, was a football player with good muscular structure and a lot of activity. But what he ate was poisoning his body because he didn't eat real food. He ate processed manufactured food. But I don't want to get into that for the moment. I want to talk to you about why you need to have a DRI exam, even if you're in your 20s, and if you're 40s or 50s, very much more so. To make sure there's no confusion, there's another technology for capturing pictures of the retina called Optos, O-P-T-O-S, or OptoView. I do not recommend this technology. It takes very low resolution pictures that are red-green, make it very difficult to make any valid diagnosis. It's kind of an interesting idea, but it never worked. Your doctor will have a retinal camera that can do digital retinal imaging. If they don't, you probably shouldn't be seeing them because it's essential for modern eye care. So this is the type of retinal image you want when you see your doctor. 10 years ago, when this became possible, I wrote some software to make it possible to use this technology as a screening tool. Back then it was only used to diagnose disease. Writing software was my hobby. The software allowed us to easily visualize the retina and to explain to our patients what the issues were. At first, the medical community was not too receptive when I sent reports because they weren't used to seeing this. Today, they look forward to the reports. And as a matter of fact, Obamacare, or the Affordable Health Care Act, if you want to believe it's affordable, which we won't talk about for the moment. But anyway, Obamacare encourages medical doctors to work with specialists like optometrists because they will pay them better. It's called the HIDIS score if they interact with us and get reports from us. And our reports are very, very important to the doctor because it helps him make a good living, helps him make better health decisions for you, but most of all, it can keep you alive and healthy. What would you pay if you could prevent diabetes from ruining your life, a stroke, a heart attack, or blindness? All those things and more are possible if these signs are not detected. Well, the signs can be easily detected through digital retinal imaging. At the end of this video, I'm going to show you what a digital retinal image looks like and encourage you to get one. Remember, not Optos, digital retinal imaging. Your doctor should have a camera. If they don't have one, don't go to them. So, what do you need to know? When you go to the doctor's office, you want to have a digital photograph taken for the reasons I've outlined. Why? Because if it's detected early that you're having blood vessel problems, and there's an enormous number of people in America who have this issue, you can change your diet and lifestyle to prevent these issues. And our office will tell you how, because that's what holistic vision care is all about. It's not just about selling glasses like one of these famous chain stores that advertise everywhere. Eye care is really about taking care of your eyes. The glasses and contact lenses, though necessary, are secondary. And so your health is primary. Come to our office at Holistic Vision Care, holisticvisioncare.com online, and learn more. We look forward to hearing from you. The first image here is a picture of a healthy retina showing blood vessels and the round white disc, which is nervous tissue. The second picture you see here shows two green circled areas. These are where the blood vessels cross each other and demonstrate hardening the arteries very, very early before a health problem occurs.